It's 9 days since Uganda confirmed the first Bundibujo Ebola case following the World Health Organization's announcement of an outbreak of the disease in the Democratic Republic of Congo. Since then, health officials have been working to prevent its spread. This has led to the increased surveillance at the Uganda-Congo border, leading to the suspension of cross-border movement in the area. In addition, President Museveni, in his letter dated 17th May 2026, suspended this year's Mother's Day celebrations at Namugongo to help contain the disease. Besides this, the United States also suspended issuing visas to Ugandans wishing to travel to the country to prevent the spread of the disease. Although these measures are being taken, Ebola cases in the country have risen, with the Ministry of Health today identifying 3 more patients. This brings to 5 the total number of confirmed cases since the outbreak earlier this month. Among the new cases is a Ugandan driver who transported the first Ebola patient and a health worker who took care of the patient. Health officials say the 2 are receiving treatment.
But also those ones, they were in our isolation, so we will continuously to monitor.
The third case is a Congolese woman who entered the country through Arua district before proceeding to Entebbe on a chartered flight. According to Health Ministry, this patient presented abdominal pain, and on 10th May she went to the private hospital in Kampala for treatment. She was discharged on 14th before returning to Congo.
How we got to know was the person who brought the pilot. So when we made announcement that we got Ebola, she remembered that she airlifted a sick lady from Arua and brought it to Kampala, and brought her to Kampala. So when we got to know that, we had to go, hospital by hospital until we got to land on that name. So went into the lab samples they had taken, because she came with abdominal pain. When we got that information, we had to come and dig the samples from the lab and tested, and it's positive.
A few moments after Uganda announced these 3 more cases, a meeting that attracted health workers from Uganda, South Sudan and Democratic Republic of Congo and other stakeholders, including officials from the African CDC and World Health Organization, kicked off at Speke Resort Munyonyo in Kampala to discuss how to control the spread of the disease.
The most important thing is really to lay strategy on how to approach this epidemic in a practical term, real practical terms. We want to see how we can, for example, work with DRC, and also to make sure that we internally strengthen our surveillance.
During the meeting, partners from the World Health Organization and African CDC pledged $214 million to help fight the disease in the affected countries.
I think many more partners will be committing, and also we hope that also even those commitments will come through and they support actual work, because sometimes many declarations, sometimes they are not felt when it comes to real implementation on ground. So but for us, whatever is available, we are ready to move, and because the issue is urgency.
Dr. Dana Atwine, Permanent Secretary of the Ministry of Health, says the new cases have traversed various parts of the country and urged Ugandans to stay vigilant. As we speak, cross-border movements between Uganda and Congo remain restricted as one measure to control the spread of Ebola. Dorothy Najita, NTV Weekend Edition.